open the floor to any questions. Come up to the mic.
It was interesting to hear about the identical twin who did have the, was it intermittent rather than constant exotropia of 15? So is there any adverse effect if this were used, the first generation one were used on a patient with a larger deviation than 5 prism diopters? Could there be some sensory abnormality induced with use of this device?
So I think all studies on binocular treatment included patients with basically very small strabismic deviations. What we do is if we see the patients have, for example, convergent success, we will put them into glasses that are the maximum plus and add maybe the add they are wearing, and that we know that patients that have the less the strabismus, the more they can improve. And we also know that strabismus is a barrier for improvement in visual acuity. So in the real world, there are a lot of patients that were included in the study that had all kinds of XTs, ETs, and they improved, but these weren't the patients that were included in the strict criteria of the RCTs.
I initially limited my strab to 5 diopters. I've kind of branched out to 10. I did run into trouble though with a 2 to 3 diopter hypertropia that eye tracking had a problem with.
If we see patients who are outside of the 8 or 9 or whatever, and they've come in and they've failed patching or whatever, and they want to try this, how does that get handled? They can do the cash thing?
We follow the exact same process for on-label and off-label referrals. The insurance conversation regarding the insurance approval of that on-label, off-label is really insurance specific.
Okay.
So can I just ask, so what you're saying is if it's off-label, you could submit it to you guys and you try to get it approved through insurance?
We do.
And it's the same program?
Exactly correct.
Okay.
Sihan?
Hello. Do you think extending the daily period of treatment may have some additional effect, especially in summertime and so on, by 2 sessions, let's say in the morning, 1 more session in the afternoon? Did you have any patients that you have tried this? Because we have heard that it has an additional effect when you combine it with patching. But I wonder whether if you, let's say, double the time, the period that the patient is by using this. Did you have any experience on that? What do you think?
So actually in all the studies, the reason we made it an hour and a half a day because we didn't want to make it like 45 minutes a day or an hour a day and then see that it possibly wasn't strong enough and we would lose all the data and we would have to do another study. In the studies, some of the patients were adherent to more than 100%, so they did over an hour and a half a day, and they had very good adherence. I personally think that the treatment of 16 weeks for many of the patients is too short, and that's why it is recommended that we taper the treatment, just like we would do with patching. I don't think we patch for 4 hours a day and go down to 0. We patch and then taper it to half, follow, and then continue deciding what to do. But I think an hour and a half is purely good and maybe too much even.
Okay.
How do you know when you're done? Say the vision approves, and then how long do you keep doing it after that? Or if they don't improve, how long do you keep trying it?
I'll take that one. So now that I've kind of added a little bit of patching, I'm a little more comfortable. I'll taper off. The company wants us to do at least 4.5 hours a week. So with the mindset, and to answer the other question, some of my overzealous parents are doing twice the recommended. because you can see it on the monitoring station. But assuming we're at the 6 to 7.5 hours per week, I'll taper down for a month to 4.5, and then we'll do a washout period. And the device more than likely has gone back if we're all comfortable. But it has been my experience that if these folks need to do a little bit of maintenance patching, they're much more open to Dear Doctor recommending it now.
Okay. So if no more questions, thank you very much, everybody, for attending. Thank you.